Hello there, and welcome back to our channel. I'm here today to talk about something that affects nearly half of all adults over 45. Yet many people don't even know they have it. We're talking about high blood pressure, also known as hypertension. If you're watching this video, chances are you or someone you care about has been told they have high blood pressure. Or perhaps you're being proactive about your health as you enter your 40s and 50s. Either way, you're in the right place. Today, we're going to break down everything you need to know about high blood pressure in plain, straightforward language. No medical jargon, no complicated terms that leave you more confused than when you started. We'll talk about what those numbers really mean when your doctor takes your blood pressure, why this condition is often called the silent killer, and most importantly, what you can do about it starting today. By the end of this video, you'll have a clear understanding of high blood pressure and practical steps you can take to protect your health. So grab a cup of tea, get comfortable, and let's dive in. What is high blood pressure? Let's start with the basics. Your heart is essentially a pump that pushes blood through your arteries to deliver oxygen and nutrients throughout your body. Blood pressure is simply the force of that blood pushing against the walls of your arteries. Think of it like water flowing through a garden hose. The pressure of that water against the hose walls is similar to blood pressure in your arteries. When we measure blood pressure, we get two numbers. The top number, called systolic pressure, measures the pressure when your heart beats and pushes blood out. The bottom number, diastolic pressure, measures the pressure when your heart rests between beats. You'll often hear these expressed as something like 120/80. Now, high blood pressure, or hypertension, occurs when that force against your artery walls is consistently too high. It's like having the water pressure in your garden hose turned up too high for too long. Eventually, that extra pressure can damage the hose, and the same thing happens to your arteries and organs. Understanding blood pressure numbers. Let's talk about what those numbers actually mean for your health. For adults, we generally categorize blood pressure into several ranges, and understanding these can help you know where you stand. Normal blood pressure is less than 120 systolic and less than 80 diastolic. This is where we want to see most people, most of the time. Elevated blood pressure falls between 120 to 129 systolic, with the diastolic still under 80. This is a warning sign that you're heading toward high blood pressure territory. Stage 1 hypertension ranges from 130 to 139 systolic or 80 to 89 diastolic. This is where your doctor will likely start talking seriously about treatment options. Stage 2 hypertension is 140 or higher systolic or 90 or higher diastolic. This definitely requires medical attention and likely medication. Finally, there's what we call a hypertensive crisis, which occurs when blood pressure shoots above 180/120. This is a medical emergency that requires immediate attention. Now, I want to address something that might be confusing. You might have heard different numbers from different sources. Some guidelines use 130/80 as the threshold for high blood pressure, while others use 140/90. The American Heart Association updated their guidelines in recent years to the lower numbers, recognizing that damage to your cardiovascular system can begin at lower pressures than we previously thought. Why high blood pressure is called the silent killer. Here's what makes high blood pressure particularly dangerous, especially as we get older. Most people with high blood pressure feel absolutely fine. You can have dangerously high blood pressure and feel perfectly normal, going about your daily activities without any symptoms whatsoever. This is why hypertension has earned the nickname the silent killer. It's silently damaging your body while you feel fine. The damage accumulates over months and years, affecting your heart, brain, kidneys, and blood vessels throughout your body. When symptoms do appear, they usually indicate that blood pressure has reached dangerously high levels, or that damage has already occurred. These symptoms might include severe headaches, blurred vision, chest pain, difficulty breathing, or irregular heartbeat. By the time these symptoms appear, you're often dealing with a medical emergency. This is particularly important for those of us over 45, because our risk increases significantly with age. As we get older, our arteries naturally become less flexible, and our bodies become less efficient at regulating blood pressure. Additionally, we may have accumulated other risk factors over the years, such as weight gain, less physical activity, or dietary habits that contribute to high blood pressure. The good news is that even though high blood pressure is often symptomless, it's easily detected with a simple blood pressure check. This is why regular checkups become so important as we age. Causes and risk factors. Understanding what causes high blood pressure can help you take control of your health. There are two main types of hypertension, and knowing which type you might have affects your treatment approach. Primary or essential hypertension accounts for about 90 to 95% of all cases. This type develops gradually over many years and doesn't have one single identifiable cause. Instead, it's usually the result of multiple factors working together over time. Secondary hypertension, on the other hand, is caused by an underlying medical condition. This might be kidney disease, hormonal disorders like an overactive thyroid, certain medications, or sleep apnea. Secondary hypertension tends to appear more suddenly and can be more severe. But the good news is that treating the underlying condition often improves the blood pressure. Now, let's talk about the risk factors that are particularly relevant for people in their 40s, 50s, and beyond. Age itself is a significant risk factor. As we get older, our arteries naturally lose some of their elasticity, making it harder for them to expand and contract with each heartbeat. This increased stiffness means higher blood pressure. Family history plays a role too. If your parents or siblings have high blood pressure, you're more likely to develop it yourself. While you can't change your genetics, being aware of your family history helps you stay vigilant about monitoring and prevention. Weight is another major factor. Carrying extra weight, especially around your midsection, increases your risk significantly. As we age, many of us find it easier to gain weight and harder to lose it, making this a particularly relevant concern for our age group. Physical activity levels often decline as we get older, whether due to busy careers, family responsibilities, or physical limitations. However, a sedentary lifestyle significantly increases your risk of high blood pressure. The good news is that even moderate increases in activity can make a meaningful difference. Dietary factors become increasingly important with age. A diet high in sodium, processed foods, and saturated fats contributes to high blood pressure. Many of us developed eating habits in our younger years that we've carried forward, but these habits can become more problematic as our metabolism slows and our bodies change. Alcohol consumption is another factor to consider. While moderate alcohol intake might have some health benefits, excessive drinking definitely raises blood pressure. As we age, our bodies may process alcohol differently, and what was once moderate consumption might now be excessive. Chronic conditions that become more common with age, such as diabetes, kidney disease, and sleep apnea, all increase the risk of developing high blood pressure. Additionally, certain medications commonly prescribed to older adults can contribute to elevated blood pressure. Stress is often a significant factor for people in our age group. Whether it's work pressures, caring for aging parents, financial concerns, or health worries, chronic stress can contribute to high blood pressure over time. Health complications of untreated high blood pressure. Let's talk about why managing high blood pressure is so crucial. When left untreated, high blood pressure can cause serious damage throughout your body. Understanding these potential complications isn't meant to frighten you, but rather to emphasize why taking action is so important. Your heart bears much of the burden when blood pressure remains high. The heart has to work harder to pump blood against the increased pressure in your arteries. Over time, this extra work causes the heart muscle to thicken and become less efficient. This can lead to heart failure, where your heart can't pump enough blood to meet your body's needs. High blood pressure also increases your risk of heart attack by damaging the arteries that supply blood to your heart muscle. Your brain is equally vulnerable. High blood pressure is one of the leading risk factors for stroke. When blood pressure is consistently high, it can damage the delicate blood vessels in your brain, making them more likely to burst or become blocked. Even mini strokes, which might not cause obvious symptoms, can accumulate over time and contribute to cognitive decline and dementia. Speaking of cognitive function, research has shown that people with untreated high blood pressure are more likely to develop problems with memory, thinking, and decision-making as they age. This connection between blood pressure and brain health is particularly relevant for those of us concerned about maintaining our mental sharpness as we get older. Your kidneys, which help regulate blood pressure, can also be severely damaged by hypertension. High blood pressure can damage the small blood vessels in your kidneys, reducing their ability to filter waste from your blood effectively. This can eventually lead to kidney failure, requiring dialysis or transplantation. Your eyes contain some of the smallest blood vessels in your body, making them particularly vulnerable to high blood pressure damage. Hypertension can cause bleeding in the retina, swelling of the optic nerve, and even vision loss. High blood pressure can also lead to aneurysms, which are dangerous bulges in your blood vessels that can burst and cause life-threatening bleeding. It can also contribute to peripheral artery disease, where the arteries in your legs become narrowed, causing pain and mobility problems. Perhaps most concerning for many people our age is the connection between high blood pressure and sexual health. High blood pressure can reduce blood flow throughout the body, including to the sexual organs, potentially causing erectile dysfunction in men and reduced sexual satisfaction in women. The cumulative effect of all this damage is that untreated high blood pressure significantly increases your risk of disability and premature death. However, the encouraging news is that these complications are largely preventable with proper blood pressure management. Diagnosis and monitoring. Getting an accurate diagnosis of high blood pressure involves more than just one reading at your doctor's office. Blood pressure can vary throughout the day and can be affected by stress, physical activity, caffeine, and even the time of day. Your healthcare provider will typically take multiple readings on different occasions before diagnosing hypertension. This is because many people experience what's called white coat hypertension, where their blood pressure spikes simply from being in a medical setting due to anxiety or stress. For a more accurate picture of your blood pressure patterns, your doctor might recommend 24-hour ambulatory monitoring. This involves wearing a small device that automatically takes your blood pressure at regular intervals throughout the day and night. This gives a much more complete picture of how your blood pressure behaves during your normal daily activities. Home blood pressure monitoring has become increasingly important and accessible. Modern home monitors are accurate and easy to use, allowing you to track your blood pressure in the comfort of your own home. This can be particularly valuable for people our age, as it eliminates the white coat effect and provides your healthcare team with valuable information about how your blood pressure responds to lifestyle changes or medications. When measuring blood pressure at home, it's important to follow proper technique. Sit quietly for at least 5 minutes before taking a reading. Use a properly sized cuff on your upper arm. Keep your arm supported at heart level and avoid talking during the measurement. Take readings at the same time each day and keep a log to share with your healthcare provider. It's worth noting that some people experience the opposite of white coat hypertension, called masked hypertension. These individuals have normal readings in the doctor's office, but elevated pressure during their daily activities. Home monitoring can help identify this condition, which might otherwise go undetected. Treatment through lifestyle changes. Now let's get to the good news. There's tremendous power in lifestyle changes when it comes to managing blood pressure, and many people can significantly improve their numbers through these changes alone. Weight management that is often the most impactful change you can make. Even modest weight loss can have dramatic effects on blood pressure. Studies show that losing just 5 kilograms can lower blood pressure by about 4 to 3.5 millimeters of mercury. For many people, this could be the difference between needing medication and not needing it. As we age, weight loss can feel more challenging than it once was. Our metabolism naturally slows down, and we might be dealing with physical limitations that make exercise more difficult. However, even small, sustainable changes can add up to significant results over time. Focus on gradual, realistic goals rather than dramatic changes that are hard to maintain. Physical activity is equally important and doesn't require joining a gym or running marathons. The goal is at least 150 minutes of moderate aerobic exercise per week. This breaks down to just 30 minutes, 5 days a week. Moderate activity means you can still carry on a conversation while exercising. So we're talking about brisk walking, swimming, cycling, or dancing. For those new to exercise or dealing with physical limitations, start slowly. Even 10-minute sessions throughout the day count toward your weekly goal. Gardening, taking the stairs instead of the elevator, or parking farther away from store entrances all contribute to your activity level. Resistance training, such as lifting weights or using resistance bands, provides additional benefits for blood pressure control. Aim for 2 to 3 sessions per week, focusing on major muscle groups. This type of exercise becomes increasingly important as we age to maintain muscle mass and bone density. Your diet plays a crucial role in blood pressure management, and this is where the DASH diet comes in. DASH stands for Dietary Approaches to Stop Hypertension, and it's specifically designed to lower blood pressure through food choices. The DASH diet emphasizes fruits and vegetables, aiming for 7 to 9 servings daily. These foods are rich in potassium, magnesium, and fiber, all of which help lower blood pressure. A serving might be 1 medium apple, half a cup of cooked vegetables, or 1 cup of leafy greens. Whole grains are another cornerstone of the DASH diet. Choose brown rice over white rice, whole grain bread over white bread, and oatmeal over sugary cereals. These foods provide fiber and nutrients while avoiding the blood sugar spikes that can contribute to blood pressure problems. Low-fat or fat-free dairy products provide calcium and protein without excess saturated fat. If you're lactose intolerant or prefer non-dairy options, look for fortified alternatives like almond or soy milk. Lean proteins include skinless poultry, fish, and legumes. Fish is particularly beneficial, especially fatty fish like salmon, mackerel, and sardines, which provide omega-3 fatty acids that support heart health. Nuts and seeds, while high in calories, provide healthy fats and can be included in moderation. A small handful of unsalted nuts makes a good snack and can help you feel satisfied between meals. Perhaps most importantly, the DASH diet emphasizes reducing sodium intake. Most adults consume far more sodium than necessary, with much of it hidden in processed and restaurant foods. The ideal goal is no more than 1,500 milligrams of sodium per day, though even reducing to 2,300 milligrams can be beneficial. Reading food labels becomes essential for managing sodium intake. Look for products labeled as low sodium, and be aware that sodium can hide under different names like monosodium glutamate or sodium bicarbonate. Cooking at home gives you much more control over sodium content. Use herbs, spices, lemon juice, and vinegar to add flavor instead of salt. Your taste buds will adapt over time, and you'll likely find that foods you once enjoyed now taste too salty. Alcohol consumption requires careful consideration. While some studies suggest that moderate alcohol intake might have heart benefits, excessive drinking definitely raises blood pressure. Moderate consumption means up to 1 drink per day for women and 2 for men. But as we age, our bodies may process alcohol differently, and what was once moderate might now be excessive. If you smoke, quitting is one of the most important things you can do for your blood pressure and overall health. Smoking damages blood vessels and makes them more likely to narrow, increasing blood pressure. It also reduces the oxygen in your blood, making your heart work harder. Stress management becomes increasingly important as we navigate the challenges that often come with middle age and beyond. Chronic stress contributes to high blood pressure through both direct physiological effects and indirect effects like poor sleep, overeating, or increased alcohol consumption. Effective stress management techniques include deep breathing exercises, meditation, yoga, tai chi, and regular relaxation practices. Even simple activities like reading, listening to music, or spending time in nature can help reduce stress levels. Sleep quality often declines with age, but good sleep is crucial for blood pressure control. Aim for 7 to 9 hours of quality sleep each night. Establish a regular sleep schedule, create a comfortable sleep environment, and avoid caffeine and large meals close to bedtime. Medications, when lifestyle changes aren't enough. While lifestyle changes are powerful, sometimes medication is necessary to achieve healthy blood pressure levels. This is particularly true for people with stage 2 hypertension or those with additional risk factors like diabetes or heart disease. It's important to understand that needing medication doesn't mean you failed at lifestyle management. Sometimes, genetic factors, underlying health conditions, or the cumulative effects of aging mean that diet and exercise alone aren't sufficient to control blood pressure. There are several classes of blood pressure medications, each working in different ways to lower pressure. Your healthcare provider will choose the best option based on your individual situation, other health conditions, and how you respond to treatment. Diuretics, often called water pills, help your kidneys remove excess sodium and water from your body, reducing the volume of blood and therefore the pressure. These are often prescribed as first-line treatment because they're effective, well-tolerated, and inexpensive. ACE inhibitors work by blocking the formation of a hormone that causes blood vessels to narrow. This allows blood vessels to relax and widen, reducing blood pressure. These medications also provide additional protection for your heart and kidneys. Angiotensin receptor blockers, or ARBs, work similarly to ACE inhibitors but block the action of the hormone rather than its formation. They're often prescribed for people who experience side effects from ACE inhibitors. Beta blockers reduce the workload on your heart by blocking certain nerve impulses. They slow your heart rate and reduce the force of heart contractions, lowering blood pressure. These are particularly useful for people who have had heart attacks or have certain heart rhythm problems. Calcium channel blockers prevent calcium from entering the muscle cells of your heart and blood vessels, causing the vessels to relax and your heart to beat less forcefully. Many people require more than one medication to achieve their blood pressure goals. This isn't unusual and doesn't indicate that the treatment isn't working. Different medications work through different mechanisms, and combining them often produces better results than increasing the dose of a single medication. Taking medications consistently is crucial for their effectiveness. Blood pressure medications work best when taken at the same time each day, and stopping them suddenly can cause dangerous spikes in blood pressure. If you experience side effects, talk to your healthcare provider about adjusting your medication rather than stopping it on your own. It's also important to continue lifestyle modifications even when taking medication. The combination of healthy lifestyle choices and appropriate medication often allows for lower medication doses and better overall control. Prevention strategies. Prevention, truly, is the best medicine when it comes to high blood pressure. Even if you don't currently have hypertension, the lifestyle choices you make now can significantly reduce your risk of developing it as you age. Maintaining a healthy weight throughout your adult years is one of the most effective prevention strategies. This becomes more challenging as we age due to metabolic changes, but focusing on sustainable habits rather than dramatic diets is key to long-term success. Regular physical activity should be viewed as an investment in your future health. The habits you establish now will serve you well as you age, and staying active can help prevent not just high blood pressure, but many other health problems common in later years. Building healthy eating patterns now will benefit you for years to come. Focus on whole foods, plenty of fruits and vegetables, and minimal processed foods. Learning to cook and enjoy healthy meals is a skill that will serve you throughout your life. Managing stress effectively is a lifelong skill that becomes increasingly important as we face the various challenges that come with aging. Developing healthy coping mechanisms now will help you navigate future stressors more effectively. Regular health screenings become increasingly important with age. Don't wait until you feel sick to see your healthcare provider. Regular checkups can catch problems early when they're most treatable. Building strong relationships with healthcare providers you trust is also important. Having a healthcare team that knows your history and understands your goals makes managing any health issues much more effective. Monitoring and long-term management. Successfully managing blood pressure is a long-term commitment that requires ongoing attention and adjustment. This isn't a condition you treat once and forget about. It requires consistent monitoring and management throughout your life. Home blood pressure monitoring can be an invaluable tool for long-term management. It allows you to track how your blood pressure responds to lifestyle changes, medications, stress, and other factors. Many people find that seeing their numbers improve in response to healthy choices provides motivation to continue those behaviors. When monitoring at home, consistency is key. Take readings at the same time of day under similar conditions, and keep a log that you can share with your healthcare provider. Many modern monitors can store readings or even transmit them directly to your healthcare team. Regular follow-up appointments with your healthcare provider are essential. These visits allow for medication adjustments, monitoring for complications, and addressing any concerns or questions you might have. Don't hesitate to contact your healthcare team between visits if you notice significant changes in your blood pressure, or if you're experiencing side effects from medications. Long-term management also means staying informed about your condition and being an active participant in your care. Understand your blood pressure goals. Know what your medications do and why you're taking them, and be aware of potential side effects or interactions. It's also important to recognize that your treatment needs may change over time. Medications that work well initially might need adjustment, or you might develop other health conditions that affect your blood pressure management. Staying flexible and working closely with your healthcare team ensures the best possible outcomes, living well with high blood pressure. Having high blood pressure doesn't mean you can't live a full, active, and enjoyable life. With proper management, most people with hypertension can participate in all the activities they enjoy and maintain excellent quality of life. The key is viewing blood pressure management as part of an overall healthy lifestyle rather than a burden or limitation. Many people find that the lifestyle changes required for blood pressure control actually improve their energy levels, mood, and overall sense of well-being. Travel is still entirely possible with high blood pressure. Just make sure to bring adequate medication supplies, maintain your routine as much as possible, and be aware that changes in time zones, diet, and activity levels might temporarily affect your blood pressure. Exercise and physical activity should be embraced rather than feared. Work with your healthcare provider to determine appropriate activity levels, but for most people with well-controlled blood pressure, regular exercise is not only safe but beneficial. Social activities and dining out can still be enjoyed with some planning. Many restaurants now provide nutritional information, and you can make heart-healthy choices without feeling deprived. Focus on enjoying the social aspects of dining while making mindful food choices. Managing stress becomes particularly important, and this might mean reassessing priorities and commitments. It's okay to say no to activities or responsibilities that create excessive stress, especially if they're not essential to your well-being or happiness. As we wrap up today's discussion, I want to leave you with some key takeaways and actionable steps you can implement starting today. First, remember that high blood pressure is incredibly common, especially as we age, but it's also highly manageable. You have more control over your blood pressure than you might think, and the steps you take today can significantly impact your health for years to come. If you haven't had your blood pressure checked recently, make that appointment today. Early detection and treatment are crucial for preventing complications. Don't wait until you have symptoms, because, as we've discussed, high blood pressure often doesn't cause noticeable symptoms until serious damage has occurred. Start implementing lifestyle changes gradually. You don't need to overhaul your entire life overnight. Pick 1 or 2 changes to focus on initially, such as taking a daily walk or reducing sodium in your diet. Once these become habits, add additional healthy behaviors. If you've been diagnosed with high blood pressure, take your medications as prescribed and maintain regular follow-up appointments with your healthcare provider. Don't hesitate to ask questions or voice concerns about your treatment plan. Consider investing in a home blood pressure monitor if you haven't already. This simple tool can provide valuable information about your blood pressure patterns and help you track your progress. Focus on building sustainable, long-term habits rather than looking for quick fixes. The lifestyle changes that benefit blood pressure are the same ones that promote overall health and well-being as we age. Remember that managing high blood pressure is an investment in your future self. The steps you take now to control your blood pressure can help ensure that you remain active, independent, and healthy as you age. Finally, don't try to manage this alone. Build a support network that includes not just your healthcare team, but also family and friends who can encourage your healthy lifestyle choices. Consider joining community groups focused on healthy living, or find online communities where you can share experiences and get support from others managing similar health challenges. Your health is your most valuable asset, and taking control of your blood pressure is one of the most important things you can do to protect that asset. You have the power to make a significant difference in your health outcomes, and it's never too late to start. Thank you for spending this time with me today, learning about high blood pressure. I hope this information has been helpful and that you feel empowered to take positive steps for your health. Please like this video if you found it useful, subscribe to our channel for more health-focused content, and leave a comment below, sharing your own experiences or questions about managing blood pressure. Remember, while this video provides general information about high blood pressure, it's not a substitute for personalized medical advice. Always consult with your healthcare provider about your specific situation. And before making significant changes to your diet, exercise routine, or medication regimen, take care of yourselves, and I'll see you in the next video where we'll be discussing another important health topic for adults over 45. Until then, stay healthy and stay informed.